In this video, we are going to quickly cover dermatology MCQs asked in UPSC examination 2022, both in paper 1 and paper 2. These are all the concepts which were tested, and you can see that HIV is a very, very important topic. Hello dear students, myself Dr. Maddineni Srinivas, Dermatology faculty from Bharat. So let's begin our discussion. Before that, I have made videos in 2023 and 2024. The links are there in the description, also in the comment, you can check them out. So this is the first question. So a boy is coming with frostbite, and you need to identify which of the following is contraindicated as the initial treatment. And remember dear students, massage is definitely not to be done as initial measure, because this is going to cause even more tissue damage and cell damage is going to occur, and also along with that there is a possibility of dislodgement of any microthrombi. So that is the reason why massage is definitely contraindicated. Rewarming is definitely indicated. Cleaning the injured area with soap is also indicated. That is going to prevent any secondary bacterial infection. And because frostbite is going to be associated with the pain, so analgesia and also sterile dressing are also indicated. Okay, so this is the literature. You can pause this and you can check the literature, and this is how frostbite can present clinically. Next is this question. So you need to identify the pharmacological treatment for hirsutism. Remember dear students, estrogen, finasteride and spironolactone, all these can be used. So answer is going to be option D, that is 234. Amiloride, it is not having any usage. Basically amiloride is a potassium sparing diuretic with very weak anti-androgenic activity, but it is not recognized as a standard therapy for hirsutism. And rest of the other medications, as you can see here, estrogen, it is used as a contraceptive, and it is going to suppress the ovarian androgen production and also increases the sex hormone binding globulin, thereby reducing the relative androgen levels in the blood. So thereby it is going to be useful in the hirsutism. Finasteride, it is a phi-alpha reductase inhibitor, particularly type 2 phi-alpha reductase inhibitor. Thereby it will reduce ultimately the dihydrotestosterone. So there is going to be use in the hirsutism. Spironolactone, it is an androgen receptor antagonist. So this is also going to inhibit the androgen synthesis, thereby reducing hirsutism and useful in the treatment of hirsutism. So next is this question. You need to identify which of the following is least likely to be occurring with CD4 count more than 100 cells per mm3. So remember dear students, cerebral toxoplasmosis is a indicator that the patient is having CD4 levels of less than 100, but if it is more than 100, the possibility of cerebral toxoplasmosis is very rare. So that is the reason why answer is option A. Rest of the others, tuberculosis, herpes zoster and PCP, they can occur even if the CD4 counts are more than 100. So you need to identify which of the following drugs carry definite risk for causing the hemolysis in persons suffering from G6PD deficiency. Remember dear students, all of these options, primaquine, dapsone, cotrimoxazole, nitrofurantoin, are associated with the G6PD deficiency producing hemolysis. My question for all of you is, dapsone in dermatology is used in which all conditions? Remember, I will give you the answer. It is leprosy, which is also called as Hansen's disease, and also in the vesiculobullous disorders. If you remember the dermatitis herpetiformis, in we can use in linear IgA disease, or in children it is called as CBDC, chronic bullous dermatosis of childhood. In these conditions dapsone can be used. And where is cotrimoxazole used in dermatology? If you remember the disease, that is Mycetoma, which is going to be discussed in this video also. In the actinomycetoma specifically, it is used in the modified Welsh regimen. For actinomycetoma, this is used. For specifically actinomycetoma, this cotrimoxazole, amikacin and rifampicin in combination are going to be used in dermatology. Okay, so that's why I have included this question. So this is the next one. Consider the following conditions. You need to identify which of the following is going to present with lymphadenopathy in a HIV positive patient. And remember, dear students, all these given options can present with a lymphadenopathy in HIV patient. So my question for all of you, what is the causative agent for Kaposi sarcoma? And if you have thought of human herpes virus number 8, you are absolutely correct. And remember, in tuberculosis we are going to have the lymph node involvement, which is very classical for scrofulloderma, where the patients are going to present with subcutaneous nodules, ulcers, sinuses over the neck area where the lymph nodes are going to be involved. Okay, and persistent generalized lymphadenopathy you all know, and lymphoma also, Epstein-Barr virus associated lymphoma can also present with lymph node involvement. Right. Next question, which is going to have the highest risk for HIV transmission after single exposure? Remember, dear students, answer here is going to be blood transfusion, almost with a possibility of like 90% or even more. Okay, so that is what is important. Next is this question, you need to identify what is the treatment for acne vulgaris among the given options. Topical benzoyl peroxide, remember dear students, it is a antibiotic which can be used in antibiotic resistant acne vulgaris. So one is used. Antibiotics like clindamycin, even there are others like nadifloxacin, this can be used in acne vulgaris, absolutely true. Oral isotretinoin, this is also called as 13-cis retinoic acid. 13-cis retinoic acid can also be used. Oral ivermectin is not having any role in the treatment of acne vulgaris, so answer is going to be option 1, 2 and 3. So in dermatology, where do we use ivermectin? So a very important disease you need to remember is scabies, which is produced by Sarcoptes scabies var hominis, and also you should remember larva currens, which is produced by Strongyloides stercoralis, and also cutaneous larva migrans. So these are the important conditions, and also this can be used even in the rosacea also. So these are all the conditions in which ivermectin can be used. Is very important, remember dear students. Next is this question, you need to identify cause for scarring alopecia. So remember, radiotherapy is having a possibility of development of scarring alopecia, whereas androgenetic alopecia, it is associated with non-scarring alopecia. Alopecia areata is also associated with non-scarring alopecia. Syphilis also is going to be associated with non-scarring alopecia, and specifically syphilis, the alopecia is described as moth-eaten alopecia. And related to alopecia areata, remember one important buzzword, there is going to be this swarm of bees appearance near the hair bulb due to the aggregation of the lymphocytes, which are producing the damage to the proximal hair bulb. Yes, so here you can see that the scarring alopecia, it is also called as cicatricial alopecia, and radiotherapy can cause permanent follicular damage, and so it is going to produce irreversible hair loss. That is scarring alopecia. So elderly alcoholic man who is having a maize and maize product diet is presenting with chronic diarrhea, sunburn like lesions on the exposed areas, and delirium. So you can clearly see diarrhea is there, delirium or dementia is mentioned, and sunburn like lesions, that is dermatitis, is also there. So patient is having the presence of 3Ds. What is the disease you are able to remember? So remember, it is pellagra, which is due to the niacin deficiency. And what is this necklace called as? So remember, dear students, this dermatitis, it is given a special name, it is called as Castle's necklace in the patients of pellagra. Very important from exam point of view. So you need to identify the self-injectable adrenaline epinephrine usage in dermatology or general. It is going to be with the patients of anaphylaxis to avoid the most difficult allergens, like for example peanuts, or there is a bees which are present nearby. They were very unpredictable, patient may develop the anaphylaxis anytime. So to help save the patient, we are going to have the epinephrine given to the patients. And what is it going to reverse? It will reverse the possible bronchospasm and also vasodilatation and also airway edema. All of these can produce instant death. So this is a EpiPen which the patients can use. According to National AIDS Control Program, which drugs is given to the newborns born to the HIV positive mothers to prevent the mother to child transmission? So the simple answer is it is nevirapine. Remember, it should be given within 2 hours, or we can say 3 days within the birth. Then only it is going to be very useful. Next, paper 2, Mycetoma related question, like I have already told you. It's a chronic specific granulomatous destructive disease involved in the skin and subcutaneous tissue, and you need to identify which of the following is related to the mycetoma. It is a bloodborne infection. Absolutely wrong, because it is going to be associated with some kind of a prick. It could be thorn prick, or it could be any sharp injury. Involves superficial structures only is false statement, because this can involve the deeper structures, like for example even the bone. May be caused by fungi or bacteria. Yes, this is the appropriate statement, because mycetoma is of two types, actinomycetoma or eumycetoma, which you need to remember. Frequently causes trophic changes. No, trophic changes are associated with any condition which is going to be associated with the development of anesthesia. So that is also wrong. So we are left out with option C, which is the correct statement. And remember, in mycetoma, patients are going to have the triad of granules, sinus tracts, and the tumefaction. Tumefaction or tumor like swelling. So this is going to be there. And one more thing, whenever there is a history of thorn prick which is mentioned in the question, remember, if there are linear lesions developing, then you should think of sporotrichosis, which is going to involve the lymphatics, and it is produced by dimorphic fungus Sporotrich schinki. And if the patient is having this GST, you know it is mycetoma. And if there is development of this cauliflower like verrucous lesions, then there are three possibilities. What are they? If there is on KOH presence of the sclerotic bodies, medlar bodies, copper penny bodies, then you should think of chromoblastomycosis, which is again the deep fungal infection. And if there is development after the thorn prick, cauliflower like lesions, and if you have done biopsy and granulomas are present, then you need to think of the cutaneous tuberculosis, that is TBVC, tuberculosis verrucosa cutis, tuberculosis verrucosa cutis. And if there is a HPV infection, okay, HPV infection, there are going to be multiple verrucous lesions over the prick area, and it is called as wart or verruca vulgaris. Okay, so this is how you need to come to a conclusion about the diagnosis. So this is a factual question. Maximum tensile strength that can reach after healing is complete is, remember, it is 60 to 80%. That is a maximum strength compared to the normal skin. Most common site for the development of the pressure sore in debilitated patient. This is also, remember, a factual question. It is ischium. It is ischium. So ischium. So you can see this is a ischial area where the debilitated patients are going to develop the ulcers. Next is extra-intestinal manifestation of the Crohn's disease related to disease activity. You need to identify which one is associated with disease activity among the following. Remember, amyloidosis, pyoderma gangrenosum, and also arthropathy are associated with Crohn's disease, and they are all associated with disease activity. Remember, the primary sclerosing cholangitis is associated with Crohn's disease, but more common with ulcerative colitis, but it is not related to the disease activity of the Crohn's disease. So that is the reason why better answer is going to be option 1, 2, and 4. That is option number P. So here also you can see clearly that this PSC is most strongly associated with ulcerative colitis, and not only that, and runs a course independent of the disease activity. So it is independent of the disease activity. It is hidden by me, so I am writing here independent of the disease activity. Okay, right. So pyoderma gangrenosum, how does it present? It will present as a painful ulcer. First point, painful ulcer, and it is going to spread rapidly spreading painful ulcer, and it's going to have this very, very characteristic violaceous margins. And one more point, this is a neutrophilic dermatosis which is associated with extra-intestinal manifestations of ulcerative colitis and Crohn's disease, and also it is associated with extra articular manifestations of rheumatoid arthritis. Pyoderma gangrenosum is one very important concept in dermatology which you need to remember. Next question. True about epidermal cyst. You need to identify what are the true statement. It is lined by stratified squamous epithelium. True statement. It is derived from hair follicle. In fact, infundibular portion of the hair follicle. True statement. It is also called sebaceous cyst. It is actually a misnomer, but still it is in vogue in literature, so we can say that it is also true statement. It is not fixed to skin is absolutely false statement. So better we can mark the 1, 2, 3 answer. Okay, right. Next, about glomus tumor. Basically, it arises from the succulent hair canals. This is true statement. You need to remember this. This is a factual question. The site is a nail bed. I will show you the picture. How does this glomus tumor appear like? And usually presents a small purple colored nodule, and it's going to be very, very painful. So that's why 4 is wrong. So the answer is going to be option A, 1, 2, 3. So here you can see this is a purple colored nodule which is present in the nail bed, and it is very, very painful. Glomus tumor, remember this. And screening tests for cervical cancer. You need to identify what are the screening tests among the given. So pap test, yes. HPV DNA test, we can also do this. Visual inspection with acetic acid, 3 to 5% we are going to put, and we are going to observe this whitening of the area whichever is possibly a malignant site. So this is also one very important screening test, yes. But remember, endocervical curettage is going to help in the diagnosis but not as a screening test. So that is not correct. So 1, 2, 3 is going to be the correct statements among the following. 27-year-old female complaining of greenish white discharge with fishy odor and no history of itching is there, and which of the following is the most likely diagnosis? So it is a straightforward case of bacterial vaginosis in which the examiner has actually given this whiff test, the details of whiff test, but here KOH is not added directly. Also fishy odor is there, and also no history of itching is very important, because in candidiasis and also in trichomoniasis we are going to see the patient complaining of itching. And urinary tract infection is going to present with dysuria but not a discharge. Okay, so the bacterial vaginosis is a very simple, straightforward answer. So you need to identify related to genital warts or condyloma acuminata. Remember students, condyloma lata is associated with secondary syphilis. Condyloma acuminata is other name for anogenital warts. So it is related to HPV subtypes 6 and 11. Absolutely true. These are the low risk groups. 16 and 18 are associated with high risk type of condyloma acuminata. Yes, it is a STD. It is going to involve the genitalia. So it is not going to present single. So we are going to have 2, 3, 4 as the correct answer. Option B. Right? So this is how we can see the presence of the verrucous lesions in the genitalia. So I hope this video was helpful. If so, please do hit that like button. Also do subscribe for more such awesome videos on a regular basis. Thank you so much. Happy learning. Sarvam Sarikeshwar Sarvejana Sukramod. Bye bye.